Hi, everyone, and welcome back to the Caregiver Empowerment Program. Today, we'll be talking about obsessive-compulsive disorder. How can you help? This is the second part of the webinar on an introduction to obsessive-compulsive disorder. My name is Alexandra Ferreira, and I'm a senior clinical psychologist in Newer Healthcare. In the second part of this webinar, we will be discussing some of the ways in which you can support individuals who are struggling with OCD. We'll talk about what is important in an evidence-based assessment and the intervention procedures currently used in clinical practice to support managing difficulties, symptoms, and preventing long-term implications. This webinar is suitable for caregivers and family members who are concerned about a loved one struggling with OCD. So throughout this part of the webinar, we'll be covering a series of topics. These include how can you help? How do I help the person stay well? How can we get specialist help? And we'll finalize it with a summary of the content discussed throughout this presentation. So how can you help a loved one who is struggling with OCD? There are general management tips when caring and supporting for someone who has OCD. As mentioned previously in part 1, the impact of OCD extends beyond the individual and negatively affects family members, friends, and carers. It is important to be patient, understanding, and willing to help your loved one to engage in the strategies to cope with their symptoms and unique needs. Please refer to the resource section of your learning management system for more guidance on promoting general mental well-being and anxiety management strategies, as well as a list of these guidelines which you can download and print for ease of reference. I'd like to make note here that we're going to be talking about general management tips whereby you are able to support your loved one who is struggling with symptoms of OCD. But in these resources that I've referred to now, you'll be able to find anxiety management tools and skills, which ultimately are what we seek when supporting someone with OCD, as a lot of the difficulties arise because of high levels of anxiety. Within these strategies, you may find breathing strategies, grounding strategies, mindfulness practices, and distraction techniques. So there are several management strategies that, as a loved one, we can implement in order to support individuals with OCD, strengthen relationships, and promote a deeper understanding and cooperation in the management of symptoms. These include encouraging a loved one to seek specialist support. So start by encouraging them to schedule an appointment with their GP and discuss their current difficulties. They will require referral to specialist support, which they can avail of through the public mental health system or with private companies. Offer to assist them with this process, as they may want to avoid it because it may cause them anxiety. Accompany them to appointments. So as already mentioned, individuals with OCD present with a lot of avoidant behaviors. As such, it may be important for you to support by accompanying them to their appointments if they wish, and be supportive of the treatment process. Remember, it can be very daunting to express very personal beliefs that we hold strong conviction in, and that a lot of people with OCD feel embarrassed about or feel guilty even about having. So having your support along the way of seeking that support and going through the treatment process is crucial and might require more support from you than initially anticipated. Educate yourself on OCD. Learn about the nature of OCD, its symptoms, and how it affects your loved one's daily life and experiences. Knowledge about the disorder can help you empathize and offer more meaningful support. That is precisely what we're trying to do with this webinar on an introduction to OCD. Learn to identify a loved one's obsessional and compulsive patterns. So as we referred earlier, people with OCD have both obsessions and compulsions typically, and usually these are involved in what we call an OCD cycle or pattern. So your loved one will have their own obsessions and compulsions, which will be within the context of different themes. And it is vital to understand what these are. Also, it is important to bear in mind that these may change over time. Individuals usually report that their symptoms worsen when they are criticized and blamed, as this generates more anxiety. So, once again, we have a reason here that strongly sustains the avoidance behaviors that people with OCD have and present with. So, even if sometimes an obsession might seem bizarre or a compulsive behavior might seem odd, um, it is important for us to be, again, understanding, patient, non judgmental, because this may aggravate and worsen their condition. We need to engage as well in active listening. So, providing your loved one with a non judgmental space to express their feelings and experiences, this will help them feel understood and less isolated. So, it is a time where you're seated with your loved one and you're providing them with an opportunity to express anything that's going on in terms of how they're feeling, what they're experiencing, what their concerns are. And it is a time where your focus will be to listen, to provide them with that outlet in a way that there will be no judgment or criticism of what they might say, but more supportive stance, and even validating that what they're going through sounds extremely difficult. Validate the emotions your loved one is experiencing. This can be extremely difficult for those who do not experience OCD or mental health difficulties, particularly if you never had difficult emotions as well. As mentioned earlier, OCD leads to a lot of anxiety and severe levels of anxiety and distress. So it might be hard if you're someone who doesn't experience intense emotions or have never felt overwhelmed. However, acknowledging the distress and difficulty that your loved one faces can be comforting to them and reduce their feelings of shame or embarrassment. In other words, it makes them feel like what they're going through is not it reduces the stigma, so they don't feel unwelcome, they don't feel ashamed, they don't feel like they can't reach out to you. And it does allow them to realize that they have people and support that they can reach out to whenever they do need it. And it's not only medical support and mental health support, but also the support of their loved ones. Encourage autonomy. So provide your loved one with emotional support and encouragement to take small steps towards managing their symptoms independently as they progress over time. This can help build self-confidence and reduce dependency on compulsive behaviors to manage their anxiety. This will be necessarily paired with ongoing psychological and perhaps, medical support as well, and also with the use of the anxiety management strategies that they will need to learn, but also practice in order to fully be able to manage and cope with autonomously. So, in order for them to get to this point, this guidance, encouragement, and support with this step by step approach is crucial. And over time, as they succeed in coping with their obsessional thoughts and anxiety without resorting to compulsive behaviors, they'll feel more confident and rely less on these old strategies that used to work to manage their anxieties. However, that maintained the OCD cycle. Carers and family members are encouraged to learn how to recognize signs that may indicate a change in OCD patterns and take a patient, calm, and non judgmental approach to same. These are usually observed in behavioral changes and may or may not be significant. So, some changes that you might observe and need to pay attention to may include spending large periods of time that are unexplained, whereby the individual is isolated from others, like let's say in a bathroom. We don't really know what they're doing in there, but they're spending an unusually large amount of time there. These are things that we need to notice and pick up on because within the home environment, we have more accessibility to that. Also paying attention to them doing the same behaviors repeatedly. This could be locking and unlocking doors, checking behaviors, checking the oven and the stove. It could be flicking light switches on and off. It could be a multitude of behaviors that are done repeatedly, but seemingly without a purpose. Continuously seeking reassurance is another thing that people with OCD tend to do, as we saw in part one, and it's something to be vigilant of. Engaging in a simple task and taking longer than usual, so washing hands. We all wash hands and we might do it in different ways to each other. Some might pay more attention to detail than others, and some might take a little longer because they're taking, especially since COVID, we learned how to wash our hands in a completely different way to ensure we're washing them properly. If an individual takes an unusually longer period of time to wash their hands, these are things we need to be vigilant of because they could be engaging in compulsive behaviors without us necessarily noticing that. Perpetual tardiness is another sign that we need to pay attention to, because if that is occurring, if they're continuously late to events, to appointments, professional encounters, etc., that means that they might be spending significant amount of time engaging in obsessional and compulsional patterns. Increased concerns for minor details is another thing we need to pay attention to. Severe and extreme emotional reactions that seem disproportionate to the situation. As an example, for someone who might have fear of contamination, if you touch their glass of water without washing your hands, they might become extremely upset at you and feel very anxious. And if we think about it, that's not the common response that we will receive from someone if we touch their glass or pick up their glass or move it around for whatever reason. Other things include inability to sleep properly. That is usually altered when people start feeling more levels of anxiety, change in eating habits, emotional distress, and avoidant behaviors. Now, again, if you have someone in your life who has OCD, you might already be seeing some of these signs and symptoms. The key here is to pay attention to see if there's any changes in these patterns, because these changes might be indicating an increase and worsening of symptoms and therefore require more medical and mental health support. Other things that we need to pay attention to is that we need to offer the individual support and encouragement to engage in their treatment plan and remind them that they have the right to live a meaningful and fulfilling life. Sometimes people with OCD can really develop this sense of hopelessness, which is really thinking that things will never change, life will never improve, and even go to the extent of asking, what is the point of living this way? So offering this support and encouragement, showing the individual the small changes that you notice as a loved one in their day-to-day experiences as they progress through the treatment plan is crucial in order to help them feel motivated, as well as show them that they will one day achieve their goal if they continue to engage with the plan. It is important to manage expectations about what the individual can and cannot do and respect where they are in their recovery process. It might be very difficult, for example, in a household, if a loved one is not working due to the impairments in the context of OCD, it can be quite hard on the household from a financial perspective. Now, while that might cause a lot of stress for all family members involved, it is important to understand and recognize that maybe the individual is not ready to return to work. Maybe the individual requires more time, more strategies, or they need to be at a different stage in their recovery to be able to do so and to lift the strain on the family. So there might be complications arising in the family home as a result of the impairments, but it is important for us to manage our own expectations and also to support the individual to the best of our abilities to reach the end of their recovery as soon as possible. But this will require time, patience, understanding, and willingness to help. Also, acknowledge and recognize what may seem like small accomplishments. So, for example, reducing 5 minutes of shower time. If someone takes a shower for an hour long period and they reduce it even just for 5 minutes, this might seem like a very small accomplishment for ourselves, who we might take a shower in 15 minutes. But for this person, a small reduction in the time spent in a compulsion, because that is what it is. The showering for an hour long in this example is a compulsion. So any small reduction in engagement in compulsive behaviors, be it in the frequency, be it in the duration, be it in the intensity, all of these things need to be acknowledged because these are small signs of improvement and accomplishment. They're big steps for your loved one, and that needs to be acknowledged and recognized. Encourage them to reward themselves for their progress and focus on the fact that they have evolved and not on the fact that they still have symptoms. Very important. So to refocus attention from there are still symptoms, there's still compulsive behaviors, to you're doing well, you're on the right track, and it's important that you recognize that yourself and reward yourself for that. So they can go and do something that they enjoy and something that they find motivating. Make ongoing attempts to not participate in the compulsive behaviors of your loved one. It's an important element to break that OCD cycle, and it's not always easy, of course. Explain in a calm and supportive tone that compulsions are symptoms of OCD, and you will not assist in carrying them out because you want them to resist engaging in same to break that OCD cycle. This could be a simple thing as reassuring your loved one when they are seeking that reassurance. So it is not engaging and participating in compulsions in any shape or form. Again, compulsions vary depending on the individual, but it's not partaking in them in any way. Support the individual in taking medication as prescribed. Again, we have antidepressants or or anxiety, medication for anxiety in order to help manage that emotional distress. So that is important in the context of progress and recovery. Make all efforts to keep the family and household routines without making significant changes to it as a result of a loved one's OCD symptoms. So we're not going to change any routines. We're not going to change the time that we leave the house because our loved one takes a very long time in the shower in preparation for community access. We are going to stick to routines and schedules despite the individual experiencing OCD symptoms. This will be the best way to get, as a family, as a household and family support, to get the person back on track, but without putting pressure on them to adhere to these in a very strict way. Avoid taking on extra responsibilities that impact on your own well-being in order to accommodate the individual's obsessions and compulsions. Again, for example, that constant reassurance seeking that we get from individuals with OCD can be quite impactful on our own well-being, and it can be quite draining in that we need to continuously support them and provide that emotional comfort. So we need to be mindful that, first of all, we should not participate, nor should we reinforce any compulsive behaviors, but also we need to take into account our own well-being and measure to what extent it is impacting on us and in what ways we can reduce our tendencies to accommodate these symptoms as much as possible to ensure not only our well-being, of course, but the well-being of the individual too. Encourage your loved one to join an OCD support group to share experiences and strategies with other individuals who are facing similar challenges. And don't neglect your own time and self-care. Give yourself the time to relax and engage in pleasurable activities regularly. As seen in part 1 of this webinar, we see that a lot of people, loved ones, friends, caregivers, experience sometimes a lot of negative symptoms, implications, consequences that actually can put them at risk of developing further difficulties in the context of their physical and mental well-being. So it is important that loved ones take care of themselves in order to support their own loved ones as much as possible. So as a carer, as a family member, as a friend, if you are not okay, you're not going to be able to support your loved one in the best way possible. How do I help the person stay well? Individuals with OCD can overcome their difficulties by resorting to appropriate coping strategies to manage their anxiety generated by their obsessions and compulsions. You will find that in the resources, as mentioned earlier. Also, cognitive therapy and exposure with response prevention are both crucial elements for treatment that help the individual think and behave differently in order to break that OCD cycle. For more information on the therapeutic intervention, please refer back to part one where we discussed that. Even though this is true, this does not mean that the individual will never experience obsessions or strong urges to engage in compulsive behaviors once they have developed the skills. Relapses occur and they are perfectly normal. Relapses occur especially during the treatment process, and this does not mean at all that the individual has not progressed in any way. Individuals and their carers should not be discouraged when this does occur. A relapse in OCD occurs when an individual has an obsession triggered, experiences significant levels of distress, and feels the need to engage in a compulsive behavior and at times does go ahead and engage in it. That is what we can consider a relapse. And again, it's not completely unnatural, especially as they're going through their treatment process. Part of relapse prevention consists in teaching the individual to expect early warning signs in the future and to develop a plan on how to deal with those situations when they have to or when they do happen. So, what that means is that the individual, your loved one with OCD, is going to be triggered. That means there are going to be certain events that are going to set off those obsessional thoughts. And in order to prevent relapse, they need to be able to identify in themselves when they're starting to feel anxiety, when they feel it rising, how the anxiety manifests, how does it manifest in their body, what thoughts they start having, what behaviors do they start wanting to engage in? So, what are those urges? These signs will be able to help the person perhaps avoid the situation or prevent himself from going further into the situation. And by doing so, I don't mean avoiding engaging in avoidant behaviors, but just in a way that they're able to recover from that feeling, that sense of overwhelmed sensations, and go back into the situation and resort to alternative coping strategies as opposed to compulsive behaviors. As a carer and or family member, there are things that you can do to support the individual in preventing these relapses and staying mentally and emotionally well when early warning signs start to emerge. So when you do start seeing the early warning signs, so when you start seeing people increasing their level or increase, there's an increase in their compulsions, an increase in obsessions, when there's an increase in the time that they spend with these obsessions and compulsions, changes in their routines, changes in their habits, changes in their emotional reactions, when these emerge, encourage the individual to engage with relevant services and professionals, normalize relapses in OCD, and remind the individual that even though they happen, it is easier to overcome these difficulties after having engaged in treatment. Help the individual recognize high risk situations, so situations that are likely to trigger obsessions, and encourage them to make a plan to deal with them whenever they are faced with those situations. So, in a situation where they're going to be faced with a trigger that will activate the obsessional thought, what are they going to do as an alternative to cope with the anxiety other than engaging in a compulsive behavior? That would be an example of how you can go about planning for high risk situations. But also, as mentioned in part one, the therapy will include a hierarchical setup, so a step-by-step approach where the person is exposed very gradually to situations that activate the obsessions and compulsions, going from the least anxiety evoking to the most anxiety evoking situations. So throughout the treatment, they will get the support in while developing strategies to cope with the anxiety, to prevent the compulsions from taking place, but equally on how to plan and prepare for high risk situations. Encourage the individual to engage in daily relaxation and anxiety management strategies so as to manage stress levels. We do this proactively, so we do this in a way that we prevent the escalation of anxiety and stress. So we keep it at a really good baseline. But also, the more they practice these coping skills and strategies, the better and more the more able they will be to implement them autonomously when they're absolutely required. The higher the stress levels are, the more likely we are all to experience intrusive thoughts. So remind them that this is natural and it does not represent a failure. These strategies will also be beneficial when the individual is in a triggering situation and reduce the likelihood of engaging in compulsive behaviors. And remember to be compassionate toward your loved one and their difficulties and encourage them to focus on the gains. How can we get specialist help? So, where can we find that specialist support? So, one way would be to access the Accident and Emergency Services, A&E. In the event of an emergency situation or crisis, a person can access support through the Accident and Emergency Department, A&E services, which you can find in your nearest hospital. An alternative option would be GP services, which would be the recommended option. So a referral to your local mental health service can be obtained through your GP or in times of crisis through your local A&E department. You can find more information about additional services that support individuals struggling with mental health difficulties in the resources section for this webinar on your learning management system. So to summarize, today we went through some helpful information about OCD. In part 1 and 2 of an introduction to OCD, we talked about the difficulties experienced by individuals with OCD and the impacts of this mental illness on their overall functioning as well as the people around them, how we can support them as caregivers, and where we can seek additional support in the community if required. Compared to before we started a couple of hours ago, you should now have a greater understanding of what OCD is, what are the common thoughts and beliefs associated to OCD that result in increased anxiety, the impacts of OCD on the individual and those around them, steps to take for adequate assessment and intervention procedures in managing this mental illness should it be diagnosed. In part 2, we covered what you can do to help the individual, and this included how to support someone who is diagnosed with OCD and where to seek support in the community for both the individual and caregivers of individuals experiencing OCD symptoms. Thank you for your time and attention during today's webinar. We hope you found it helpful. Should you wish to add structure to your caregiver routine, please refer to the sample tools and third-party resources associated with this webinar, which have been conveniently uploaded to your learner area of the learning management system. Please keep in mind that these are only samples, and with your newly acquired knowledge, you may choose to use these in whole or in part, or research alternative resources and tools yourself. If you have any questions in relation to any of the topics or areas raised during today's webinar, please feel free to contact our team by emailing clinicdepartment@nuahealthcare.ie. Thank you very much for your attention today, and I hope to see you soon.